Very quickly, moving into the third one, which is basically to do with what are the steps that are involved in a full mouth reconstruction. Now, I don't know about you, but I have a sweet tooth. I enjoy anything that is heavy on sugar. And if I'm given a cake to eat, I'm not going to jump in and start gobbling on that cake. I want to first cut it into pieces because it makes it more easier for me to eat the cake. Same is with a full mouth. A full mouth can often be very intimidating. It can be daunting. It can leave you with a lot of fears and a lot of doubts in your head. But if you were to break the full mouth reconstruction into steps, life can be a whole lot easier. And if you want to take your patients from there to there, I mean, look at that amazing transformation. It completely changes your patients' lives, their self-confidence, their perspective towards the world. And if you want to embark on these kind of journeys with me and with your patients, it's very important that you first understand all the steps involved in a full mouth reconstruction. And I always break a full mouth into planning and execution. All right, so planning phase and execution phase. And I'm going to list 10 different steps for planning and 10 different steps for execution. Always remember, when a patient walks into your practice needing a full mouth reconstruction, don't jump in and start a full mouth. Plan it. First, take care of their primary symptom. Take care of the primary issue that they have walked into your practice with. This could be pain. So first address that aspect and then inform the patient about the need for a more complex reconstruction. Our domain, friends, when it comes to dentistry, is to make our patients informed about the problems and their possible solutions today. And if treatment is not done, what are the possible complications that they can expect in times to come? We should not be on top of their head, forcing them for treatment. They may not be ready to receive it. At this point, it's very important that you help them understand the problem that they come to you with. You make them realize the value of treatment and then allow them to make that decision on their behalf. It's completely their mandate to choose whether they want to get the full mouth reconstruction done or not, whether they want to get it done now or not, whether they want to get it done from you or not. This is their decision. Our role is to inform them, mediate them, educate them, and help them realize that I would be the best service provider for you. And then walk the journey with them. And don't leave them with the reconstruction done. It's very important that you have a follow-up protocol with your patients. Now, friends, remember, this is the FMR crash course. It's not the portal or the place where I can give you the depths of all of these 20 aspects. I am going to try here to give you the best of the most important steps. And one aspect that I very strongly believe that is important is the aspect of a wax up and a test drive. And why is this wax up so important for me in my head? Because I believe very strongly, friends, that planning is everything. If you look at a big monument, let's say you're looking at the Burj Khalifa, and you're amazed that, oh my God, it looks such an amazing tower. And you're thinking, wow, yaar, how must it stand so well? Remember, the portion that you see is held firm because of the foundation that actually is not visible. The foundation is where the actual construction starts. It starts with planning. And if you have your plan right, only then can you make sure the end result is a favorable one. You can't go and just start putting bricks together and put cement in and expect the tower to survive. No, it has to be planned first and then executed. And what's the role of this planning, friends? Planning helps two very important things. One, it helps motivate your patients. I'm going to share with you a term that I have coined, which is called mountography. Now, mountography is a hypothetical term that I've come up with, friends. It does not present itself in a dictionary. Now, what is mountography? Mountography is basically taking records, like a face bow record, a centric relation bite record, mounting everything on a semi-adjustable articulator, getting a wax up done, making a putty index, transferring it into the patient's mouth with the help of some acrylic, and doing a test drive. Now, what's the advantage of a test drive here? You have touched the patient on an emotional front. A patient who comes dejected, unhappy with their smile, complete lack of confidence in their ability to make a conversation with people. And then when you give them or transform them with an acrylic smile saying, this is potentially what I can give you, you have touched the emotional chord for this patient. You have significantly increased the possibility of this patient agreeing to your treatment and to your treatment charges. Amazing, right? Mountography. And that's not where it ends. For me, mountography is very important because it helps me in a dynamic manner test my patient's function. So once I do a test drive, look here, I'm asking my patient to pronounce the letters F and V. Basically, the patient is going 51, 52, 53, 54. I am testing whether my incisal edge position is right, whether the display of my smile is correct. And I actually go ahead and take pictures and videos like what you see right now. And I show these to my patients. I give them as a soft copy to my patients because the confidence that they get in themselves when you look at these pictures is, oh my God, oh wow, you seriously think you can give me this? I look so good. I want this. Perfect. I'm in a position to provide you this, right? Because I have the skill, the knowledge, and the attitude for committing to a full mouth reconstruction and walking the journey with you as my patient, right? So make sure that you plan your case and first do it in wax and then in acrylic in a test drive. Let your patient approve the aesthetics. You are gauging the patient's function. I also test my patient's vertical dimension with the help of my test drive. Yes, I am testing the final vertical dimension with the help of something called a Silverman closest speaking space. I will talk about this once again when we discuss vertical dimension. Once again, coming down to the value and the importance of planning a full mouth reconstructions. That is basically, friends, how you break down the steps of a full mouth reconstruction.